An inspection of the Royal Sussex County Hospital in Brighton has found improvements to its maternity services, but more work needs to be done to meet the needs of mothers and babies.
It was announced recently that Sussex maternity services will be examined as part of a national investigation into systemic failures within the NHS.
Well, meanwhile, inspectors found new concerns with the hospital's urgent and emergency care, which has now been rated as requiring improvement. Andy Dickinson is outside the hospital for us this evening. Andy, the report did highlight improvements, but there is still a lot of concern.
Yes, Matt, concerns raised, even though maternity services here have been officially upgraded from inadequate to requires improvement. This is the result of a CQC inspection in February. We're only now getting that report where 5 breaches of regulation were found. They related to induction of labour and C-section delays, medicine and the premises, as well as how well the department was managed. Difficult reading for Katie Fowler and Robert Miller, who lost their baby here at the Royal Sussex County Hospital after she was starved of oxygen at birth, dying 2 days later.
Disappointment, really. It's been 4 years since maternity at the Royal Sussex was rated inadequate, nearly 4 years since Abigail died there. And honestly, I thought there would be more improvement by this stage. Requires improvement still means that there's a lot that's going wrong there, a lot that isn't good about the way the service is run. And honestly, I'm quite upset, really, that they haven't managed to get on top of this problem sooner.
Yeah, it's extremely personal to us. There's a lot in that report that still indicates there are big issues that need to be sorted out, and the steps that have been taken so far seem very small.
Well, a particular concern also raised there by Mr. Miller, the lack of up-to-date evidence-based guidance that he described as shocking. Meanwhile, inspectors downgraded the safety of urgent and emergency care to inadequate, in that they cited 6 incidents reported by staff that resulted in fatal harm and 5 that caused severe long-term harm. They also said patients were being cared for in corridors, and on the day of their visit, 11 had been in the emergency department for more than 24 hours waiting for beds. In a statement, Chief Executive Officer Dr. Andy Heath said, "I welcome the recognition of progress made in our maternity services. I'm pleased that inspectors highlighted the compassion and kindness shown by our staff and the strong teamwork between them. While the service has moved up a level overall, we totally accept we need to go further. The challenges highlighted in our emergency department are well known, and since the inspection we have made significant steps to address them. We've made progress, but are under no illusions of the very real pressures facing the local health system."
OK, Andy, thank you.